So I really love electric brushes. So, there are many different kinds on the market. Anyone is good. This one just happens to be a Philips Sonicare. It doesn't have to be, a specific brand. It could be. So it could be, any of them, as long as, some people like the different settings on different brushes. So some of them feel a lot stronger for some people, and it kind of almost hurts them. They feel like it's just too much vibration. And there are some that have settings, some that don't. So the ones that have setting, there's like a feather, setting. So it's like a lot lighter. And a lot of patients like that idea of being able to kind of decrease the strength of it. So the vibrations are a lot smoother. But otherwise, any electric brush over a regular brush. There's nothing wrong with the regular brush. I just think an electric brush will do a much better job. Oh, no. The timer is great. Yes, that's great. But a lot of them, the timer is just usually incorporated in the noise.
Right.
So when you're using it, it will kind of vibrate a little louder after 50 seconds, and then it becomes 1 minute, then it goes up to 2, and it tells you, okay, you're done, don't well, at least mine does. It's gets mad because I brushed too long. But another thing that is really important when it comes to electric toothbrushes is that everyone is different, but they come with a warning that tells you you're brushing too hard. Now, it could be either a red light that goes off, some kind of vibration, some kind of noise, but it's probably the most important thing when it comes to electric toothbrushes, because it's doing all the work for you. I've seen, especially in younger male patients, they put so much pressure as if they're washing, a really particularly dirty cloth, and they need to really scrub it. It's definitely not necessary. It's the wrong notion that you need to put any kind of pressure, especially with an electric brush. An electric brush, really all that's necessary is making sure the brush is placed on the surface of the tooth. It covers a little bit of the gum, but that's it. And it just, all you do is hold it there and move forward, and make sure every tooth structure is covered from all angles. So, down here, on the insides, next to the tongue, it's all covered, especially these back, teeth, they always get ignored. So these back teeth need to be really taken care of from all angles. And then down here, I see a lot of people are having a hard time, and that's the best way is to just go straight, in at that angle and kind of get that cleaned out. Okay, so really you don't need to put any movement into it. With a regular brush, there are a couple movements. Is that circular movement, very gentle circular movement, or going, and the brush strokes on the bottom, it goes towards the top, as in enforcing the gum to kind of, stay in place. It's really not gonna grow it or anything, but it will, make sure it's not irritating it. And on top, it's going towards that, lower part, it's going downward brush strokes, so that it cleans everything out. But you don't need to do that with an electric toothbrush at all. You just really making sure every surface of the, teeth is in contact with the brush, and around the angles really is probably one area that a lot of people have difficulty making sure they're not skipping the canines, the eye teeth, and giving it enough time and surface interaction with the brush. But otherwise, yeah, I think electric toothbrush all the way. Definitely soft bristles, never medium or hard. No, I always just recommend soft. There's no need, like I said, the same reason you don't need to brush really hard. It's not gonna make any difference. The only thing it's gonna do is damage the teeth. You could definitely damage teeth by brushing too hard or using a hard bristle toothbrush. Even though teeth are probably, are the strongest thing in the mouth, they're stronger, enamel's stronger than bone. But if you are constantly going at it with a very hard brush and abrasive toothpaste, you're gonna take, enamel off, like microscopically. Over the years, it kind of makes a difference, and it could damage the teeth, and it could really do a number on the gums. So, you really want to be careful what kind of toothbrush.
Is there